when Sarah was speaking earlier, a few hours ago, she was talking about the inequalities in the provision of care. And one of the concerns of many countries was the capacity of countries in order to provide care. So I want to turn with that as a forward to Ellen Block. Ellen was part of a study in collaboration between the US and the UK, looking at how health workers coped, how they made do when they lacked resources, when they lacked sufficient staff, and when they were working under crowded conditions. And again, this is a global concern. And so it is true not only for countries with weak health systems, but countries that claim that they have stronger health systems. Ellen, are you ready?
Yeah, thank you so much. So yeah, I did this work with my colleague Cecilia Vendrola-Padros out of the Rapid Research Evaluation and Appraisal Lab at UCL. And actually there was mirror studies happening all over the world. I think more than 30 countries were involved in these mirror studies of healthcare provider experiences. So while this work was a reflection of the comparison between the US and the UK, we also were working on another edited volume where authors were contributing from all over the world as well. We were focusing on improvisation, and the reason we chose to do that is, first of all, because in these clinical spaces, just the sheer volume of improvisation was really surprising to us and kind of hard to ignore. And second, we were thinking about improvisation as an anthropological concept, thinking about tinkering in biomedicine and how we usually think of tinkering occurring on the part of the patient. But in this case, it was healthcare providers were doing the tinkering, which was really kind of surprising to us. We normally think of healthcare institutions as being fairly resistant to change and highly routinized. But we noticed that healthcare providers were making drastic micro and macro changes extremely quickly in clinical spaces, partly because of their sort of lack of knowledge about what to do and the resource shortages that were happening everywhere. Some of the macro changes included kind of completely altering how the space of the hospital was organized, totally changing how triage was occurring in a matter of days or weeks, implementing telehealth in a matter of weeks, something that otherwise might take a decade, some doctors told me. And then micro changes included batching care so that nurses were only going into COVID patients or any patient's rooms maybe once an hour to do everything at once rather than going in every 15 minutes. Talking to patients from the nurses station. One nurse told me she would write up on the whiteboard, do not ring your bell, call us at this number if you need to talk to us. Or even lots of examples of people stringing IV tubes under the door, like getting extra IV tubes, attaching them and stringing them under the patient's door so they could change medication without actually having to go in. And while this improvisation reduced the risk, it also increased the isolation of patients and kind of the moral distress of healthcare providers who weren't able to provide care as they wanted to. And some healthcare providers felt like they were being deceived by their governments. And so they felt like they needed to take matter into their own hands, especially when it came to PPE or personal protective equipment. And the pace of change was so rapid, especially around PPE, that maybe on a daily basis at the beginning, healthcare providers were being told to do one thing and then being told to do another. And it made them really feel distrustful of those recommendations. And so they were doing a lot of things on their own. And the cross-cultural comparison that Cecilia and I, as well as all these other studies around the world, kind of noticed that people were improvising in similar ways and that the pressure exerted at the beginning had a certain flattening effect. But ultimately, as we've seen from all these presenters here, that globally, the pandemic only served to sort of reinforce inequalities in clinical spaces and outside of them. So we think improvisation is a useful construct to think about the clinical space as we think about healthcare provider responses, but also as we think about the nimbleness of healthcare institutions and their capacity for change, and as we think ahead to planning for kind of future, unfortunately, future pandemics. So thank you very much.
Thank you. On a very, very bleak note, the next person that I'd like to invite to speak is my co-editor, Ayo Wahlberg in Denmark. Ayo works particularly on people with chronic conditions, and he and his team had been concerned at what happened to people who were normally dependent on social and health care. Ayo.
Thanks so much, Lenore. Yes, and some of you will notice that the 11th of March is etched into my brain, of course, because it was the date of the lockdown in Denmark. But at the same time, I was organizing an international conference on chronic living, which had to be cancelled / postponed at the very last minute. So basically, a team of ethnographers in this project on chronic living, we were researching the ways in which different forms of chronic living were playing out in welfare state Denmark. So how people living with long-term conditions were gaining access to care within the welfare state, navigating the bureaucracy and so forth. Along comes the 11th of March. We all know the background. Our prime minister in Denmark, one of the first European countries to call for a national lockdown by directly appealing to what she called the social contract between the state and the population in Denmark. So a long history of the welfare state immediately kind of invoked, and this idea of flattening the curve, which was used around the world, but in Denmark was very much framed within this social contract. So it was clear from day one that the responsibility of making sure that we got through the pandemic was the people's. We had to play our part in making sure that we could flatten the curve in order to make sure that our healthcare system, as we just heard from Ellen, was kind of kept free of at least the worst kinds of overwhelmings that we've seen across the world. At the same time, very openly, the Prime Minister spoke directly in her TV address to people with the so-called underlying conditions, people living with long-term chronic conditions, saying very specifically that you, as people with living with chronic conditions, will have to bear the hardest burden, because you will have to, on top of the general keeping distance and so forth, you will have to isolate yourself until further notice. And to make matters even more, let's say, challenging, within the official documents that were rapidly prepared to try to, build up the response of the welfare state, these conditions were referred to as stable illnesses. So stable illnesses could, for a time, be deprioritized, because now we had to shift all finances and healthcare resources to addressing this global pandemic. So really, this word stable illnesses was something that struck us as researchers. So my collaborators, Sophia Rosenlund-Lau, Maria Svensson, and Natasha Kingod, who I was working together with, as said, we were each engaged with a different project. So Sophia working with multi-morbidity among particularly disadvantaged elderly groups, Maria with families who live with congenital heart defects with one of their children, and Natasha Kingod, who was working with type 1 diabetes. And what we show is that by using this phrase, stable illnesses, as we've already heard in a few of the presentations today, what happened was all the work and efforts that these families put into their, tackling their chronic conditions was invisibilized, because it came to be known as stable. And what we show through interviews with our interlocutors was that isolation had this disproportionate effect, and it was very embodied, especially for the elderly with multi-morbidities. And indeed, one of Sophie's interlocutors ended up being, unfortunately, someone who contracted COVID very early on and passed away, one of the first behind the Danish numbers, so to say. Marie showed how among families with living with congenital heart defects, a lot of uncertainty of being at risk and then again at risk from this new COVID-19 virus, lots of questions and worries. And similarly, Natasha with type 1 diabetes, families living with type 1 diabetes were kind of doubly affected by being at risk of the complications of type 1 diabetes and then being told in different ways and in often conflicting ways. And they didn't even, at the end of a few months, they were still unsure as to whether they were at risk or not. So all these uncertainties were masked by this kind of labeling of stable illnesses. So through our chapter called Carescapes Unsettled, we wanted to kind of highlight the ways in which this kind of shift of priorities to COVID-19 really had an impact on those living with under the so-called underlying conditions of COVID.
Thank you so much. Tanja, Ahlin, you're in Amsterdam and your fieldwork is usually in India and Oman, but in your chapter you were concerned with the way in which social media globally cared. So you were using care in a rather different way than the way, for example, that Io did. Would you like to explain what you were talking about?
Thank you, Lenore, and thanks everyone. It's really a pleasure to be here. So when the pandemic started, as we all know, countries around the world imposed a measure of physical distance among people, and this was done through more or less severe lockdowns. Now enter our new hero, social media platforms. These online channels have been praised by governments as absolutely essential in maintaining personal relationships at a distance, and the platforms themselves emphasize digital connectedness as a form of care. So how did these platforms articulate and reconfigure care in the pandemic? So to answer this question, my colleague and co-author, Erwin Cabalquinto, and I looked at selected online platforms, so Facebook, Google, YouTube, and Instagram, and we analyzed their community guidelines for 2 months in 2020. Now, what we found was that all these platforms highlighted the importance of staying connected with family members and friends while staying at home. They not only promoted chat, voice, and video calls to generate a sense of closeness while being apart, but they also promoted indoor activities, so to convince people to stay at home. YouTube, for example, created a campaign called @home #WithMe, to encourage workouts and cooking and planting at home. But what we shouldn't forget is that online platforms are not only created to facilitate sociality and connectivity, they operate on business protocols and the system of governance that is established by technological companies behind what we see whenever we go online. These companies save, store, and sell individuals' data to third parties. And this is mostly not done in very transparent ways. So essentially, social media platforms exploit care to achieve their business goals. For example, on the one hand, they partnered with WHO and national health institutions to promote what they deemed accurate information on COVID-19, while at the same time, they also represented a source of contradictory and controversial information. So when users engaged in heated debates on social media, the tech companies profited from their activities and from their data. We also found that social media channels targeted very specific kinds of audiences, specifically the digitally literate and networked individuals. So this was, for example, evident from Facebook's campaign, Get Digital, which provided a range of resources specifically targeting children and young adults, parents, and educators. Now, ironically, and also to answer the question that was posed earlier, those who were the most vulnerable in the pandemic, the elderly, were practically invisible from the kind of care supported by social media platforms. So social media promote a digitally connected, equitable, and safe environment of care, which is accessible to some, but it remains a fantasy for others. Now, societies have long been familiar with the principle of divide and conquer, and these divides have been from religious to racial, and now those related to COVID-19. But underlying these divides is the one between the extremely wealthy, so including some of those behind technological companies that own social media platforms, and everyone else. And I think it's up to all of us to realize the importance of this particular inequality and to come up with some concrete ideas on how we plan to deal with it in the years to come. Thank you.
Thank you so much. You've provided a very nice opening for the next presentation. And Haripriya is in India and will be talking specifically about WhatsApp rather than more generally social media. I will share the screen, but Haripriya, if you start speaking now. Thank you.
Thank you, Lenore, and everyone. India went into a strict lockdown on March 25, 2020, which lasted for nearly 2.5 months with only few hours of notice by the national government. It paralyzed movement of people across the country. There was a scramble to figure out how to procure food and other essential items. Social media and digital applications became hugely important during this time. So literally, people were on their mobiles all the time. And one of the popular activities that emerged at this time was WhatsApp forwards, as they are called in India, circulating memes about hardships due to lockdown from middle-class perspective through WhatsApp and other platforms. In the absence of domestic help, because they couldn't travel to work, several memes were about men being forced to do household activities, household chores, and being reduced to that of a, quote, maid, and women sitting idle and gaining weight. At around the same time, my co-authors and I were engaged in a study on the response of women, particularly working women, to the lockdown. Two factors emerged strongly. Women felt keenly the burden of care falling entirely to them in the absence of the help they had in the form of domestic helps, cooks and nannies and others. They were trying to get their husbands to take part in running the household with varying degrees of success. The second point was about the struggle that working women felt acutely about having to balance work and home. India is a WhatsApp nation. The debate that took place on social media about household work, labor, and gender dynamics through memes during lockdown reflect the struggle taking place in middle-class homes about these issues, but also about women's participation in work outside the home and men's participation within the home. The debate is ongoing. So here this is one such meme which was very popular and shared quite a bit across several media. And earlier, Lenore, you were talking to Carlos or somebody, I can't remember, about how they may be wearing a suit, but actually, could be in some other dress or something. And I was thinking of this meme actually, where they show that men appear wearing one particular dress, but actually in reality, that's not what they're doing. They're actually cooking and cleaning. If we could move to the next slide. So these were some memes about how women were sitting at home doing nothing, gaining weight to the point where people were assuming that they were pregnant, because it was all the men that were doing work in the house. Another one. So the last, this one is, the first slide especially is very funny. And I'll come to that in the, okay. Yeah, these were also circulated about how the lockdown is not the same for everyone. So people were conscious, at least some, about the disparity in economic backgrounds. And the next one is also about migrant labor walking hundreds of kilometers to their homes, which has been documented very well across media. And Dr. Bharadwaj's piece also, I think, refers to these kind of situations. The last one, which has the narrative, is from our interviews, where, you can see this woman saying, he can't cook to save his life. He has no idea about vegetables. He has to learn the name of vegetables and learn the name of various dals or lentils that you have to cook, etc. So this is what a lot of women told us, in contrast to all those memes which show men, doing all the work in the home. And the very first slide was about, the picture was about a domestic help. Finally, not this one, the one after, this one is when men are so tired cooking and cleaning that after 3 months, when lockdown ends and domestic helps start coming back, this man almost goes and hugs her. He has tears in his eyes because he's so tired of doing all the work. I want to stop here and open it for questions.
Thank you. I'm sorry for the kind of shifting around with the slides. I was trying to guess them, but sorry, I need to take that off. The last presentation from chapters, not the last presentation, but the last one from chapters relates to the pandemic as a window, or as and anticipating future health crises. And already that discussion has been opening up in relation to antimicrobial resistance and, not surprisingly, the impact of climate change. The one person who has really attended to these issues and the questions of planetary health is Gideon Lasco, writing of species and environments and human and non-human animal relationships in the Philippines, although at present he's physically in Mexico. Gideon, would you like to take over?
Thank you, Lenore, and greetings, everyone. I'd like to very quickly, I hope you can see this image. Can you see this picture of this ostrich that escaped from a village, a upper middle class village in Manila in the middle of the lockdown last year? And it elicited so much joy and excitement among people who were trapped in their homes, who were unable to leave. And there were so many jokes, so many conversations, so many artwork written about this ostrich, with people saying that, well, I envy the ostrich because at least he can get out, or at least they're able to walk the streets. So there's some transgressive power to this event, that a non-human made headlines after so much worrying about the pandemic, so much criticism about the government's pandemic response. We have this ostrich stealing the show in the Philippines. And I use this as a starting point to just reflect on the role of humans during the pandemic. What are the methodological and also the political necessities of following species as they travel and how they affect us? And in my chapter, I highlight 3 domains. I highlight the microbial and human microbe interactions. I reflect on how, in fact, our worldview has been this Pasteurian worldview of looking at pathogens as dangerous. But we've seen also in recent years how we've warmed up to microbes, people buying kefir, kombucha, looking at probiotics, recognizing how, in fact, microbes are allies. But the pandemic came along, and now there's a lot of concern about this infection, about really trying to eradicate viruses. They're the enemy. So that's the first bit. And then it moves to looking at non-human animals like the pets, how people were actually in quarantine, not just with themselves and their families, but also with non-human birds, dogs. They became more visible to us at a personal level. Anthropologists have written about how people cope with the quarantine by living with cats, living with dogs, etc. But also, aside from romanticizing the pandemic in terms of how they have led to the resurgence of nature, we've seen zoos with animals starving in zoos because there's no funding, there's no people coming in. And in the Philippines, people had to beg for help because there's no food to feed the tigers, the lions, and the other animals in zoos. So reflecting on this, and then I moved to plants and how there was a resurgence, the popularity of plants in the country. It became a whole industry in itself. Everyone were cultivating plants in their homes, tending to gardens, people giving names to their plants. And all of this taken together should lead us to looking at non-humans, not just in terms of endearment, but in the different terms of engagement that we have with them. Because ultimately, the pandemic itself is an outcome of how we have transgressed these boundaries that are supposed to exist, the poaching of bats, pangolins, etc. So at a personal level, I think that it will make us appreciate nature more and ourselves more, our world more, if we open up ourselves to these different interactions. But at a political level, we really need this as part of our survival. We need to be attentive, and that will involve alliances with different experts, alliances with different communities, including ecologists, biologists, etc. So that's basically the summation of my chapter. And I know that there's a lot to be written about multi-species engagement, and I just confined it to a more personal reflection of what went on in the Philippines.
Thank you. Thank you so much. Just to give you all a sense of where we're up to, Carlos is going to field some questions, and then we will go, and Carlos, Robin and Judith, and then Nancy Io and I will be summing up. So we're in the last lap. And Carlos, would you like to take some questions, and we'll see how we go, but I'll come in again in about 5 minutes or so. So if there are specific questions, please send them through. Thanks, Carlos.
Yeah, the questions, of course, vary from the very general to the very specific. From great accolades to all the panelists who regard you as brilliant, wonderful, and able to walk on water. These comments are absolutely wonderful. So I needed to share that up front with you. The other part is that you have from very general to very specific questions. And the general questions that really have to do with policy matters. And that is, what are the best ways in which, in fact, applied anthropologists can be involved in affecting policy? What we have here, obviously, is this great, enormous diversity of governmental response, as well as interference, as well as committing the worst kinds of foul powers available, as well as very positive intervention. So those are the kinds of questions in general that appear in this last section. But there's some very specific arenas that haven't really been treated, and that is, one has to do with the mental health issues of students. And this question arises from at least 3 different venues, ranging from Ethiopia to Bangladesh. So if we could address that question to the panelists, and especially to those of you that were in this last panel, that is the impact of the rise of mental health issues, especially among students and their capacities and abilities to be able to continue their education.
So I can quickly say from a Danish perspective, just yesterday, the kind of Association of Psychologists released their figures, and as anticipated, I guess we could say that the sheer number in terms of young people and children contacting the kind of services that are available in the Danish welfare state have just completely gone off the charts. And people were talking a lot about this as one of the kind of pandemic effects which were not being factored into the various models that were going on. And indeed, as we know, that's probably going to have knock-on effects for a very long time. So I think the numbers in a lot of countries are probably going to bear that out.
I can comment now. For the first one about the policy matters, connecting with this rapid ethnographic assessment lab was really valuable for me, because they are very focused on making those policy connections. And so they have a designer who designs communications for them, like infographics, and has really clear ways of sharing with communities, and kind of inspired me to do some of that same sharing. A report that I normally wouldn't have written, in an infographic that I made with my students to share with the healthcare providers that I worked with. And so I'm continuing to learn from that. And then in terms of students, I actually talked to a number of med students and residents in my research, and thinking not only about the mental health toll that the stress of this was taking on them, but they were also either not being able to train in the way that they needed to be, not being allowed into the clinical spaces to do the procedures that they were supposed to be learning how to do. So how does that affect our future doctors down the road? But also the ones who were allowed, and it varied widely from hospital to hospital, but the ones who weren't allowed in those spaces were seeing the same thing, especially in the emergency department. So they were losing the ability to kind of assess patients for all sorts of things. Everything was COVID. And so they lost some of those skills at the beginning. Things normalized after a while, but that was one of the early challenges. And I have to go teach a class. So thank you, everyone. I'll take it offline from here. Thanks.
Anyone else? Just one last question. I think we have enough time for one last question, Lenore. The last question is, First of all, a general accolade again. Thank you for all of your work. It is greatly appreciated. Taking back to a reflection, could panelists please talk about their methodologies, in some cases, perhaps privilege and ethics of positionality, as well as the lasting effects of innovations in methods in relation to bringing all these important stories to the world?
Well, if I may, one thing in terms of conducting empirical research was you couldn't do it during COVID, right? Especially during the first lockdown. So one of the things that happened was conducting a lot of interviews on the phone. And another was, being able to talk to people who were also significantly affected, like the domestic helps. We couldn't do it because we couldn't go to their homes or talk to them. But otherwise, also, I think the positionality question is very important. For us, the project emerged in a sense because we felt as middle-class women living in gated communities, working women, working mothers, we ourselves were struggling with the lockdown. And doing this research parallelly was very interesting in some ways. It was like our stories were also being told by other people. And then these WhatsApp memes circulating made us reflect on what does this really mean, and that's how it emerged.
Linda Ray Bennett raised her hand.
I wouldn't mind sharing a few reflections that surprised me about this research in this time of COVID, which was that it turned the power dynamics on its head in ways I didn't expect it to. So initially, the invitation for me for the research I've been undergoing came from the community themselves. And I said, well, how are we going to do this? And they said, duh, like we do everything else on WhatsApp. And I felt as if I was the person who was behind with the technology and I was the person who was catching up. They're like, we're 3 months into lockdown. What do you mean, how are we going to do this? And it was very clear, they knew straight away that they wanted credit for their phones. They wanted internet, bandwidth. They knew what the resources needed to be, and they knew who was going to be involved and who wasn't and who would be left out. And I think I was really surprised at how much agency the research collaborators and the communities that we worked in maintain. And I was scared that the field was going to close off, and it actually opened up in ways I hadn't expected to, particularly working with healthcare workers who were able to say, I've got 1 hour between the shifts and this will give me something to do and talk about. When I'm trying to calm down or, when I'm resting. So I'll call you when I want to. So there was also this thing about I will meet you in a time and space that is virtually convenient for you, and you will answer my call. And that is great. And also the cultural context that I tend to work in a lot, it's very difficult to say a direct no. So a no is 3 months silence. The word no doesn't really come out. So that there's a lot of potential for coercion. So if you invite someone directly to be involved, say you're in a sort of Zoom forum, they simply just turn off their camera and they're gone. They don't have to say no. And that also, they have to take the initiative of getting online and being there. And so it's really turned things on their heads. And I think there's a lot less coercion for me than it might be if I turn up at a village primary healthcare centre where the village head says, okay, everyone has to sit around and listen to what this woman's got to say. So, there were some interesting things to learn from that process.
Most stimulating. Lenore, I think we are out of time for this segment.
We sort of are, aren't we? Unless Tanja and Susan have got one word that they want to say.
Yeah, I just wanted, hi, can you see me? I just want to say thank you for your question. And I was thinking about your question on mental health and students at universities and in schools, and in fact, linking it to your question on methods. And one of the extraordinary aspects of being a lecturer with vast classrooms of students who were given literally 72 hours to vacate the University of Cape Town and travel either by foot or by taxi or by train or bus in really insecure spaces, trying to beat the curfew. They were around and we were in WhatsApp contact with students. And in a sense, the work that I was able to do with Lenore, Lenore being just absolutely extraordinary researcher, you know, piecing different stories together. And then I was here in Cape Town, literally on WhatsApp calls with students who were at the forefront of actually interfacing with the militia, with police, with security forces. And then, of course, you know, asking students along the way, be anonymous, can I use these stories? It became a kind of a space in which we were all beholden to the restrictions, but within the context of mental health, we were grappling with a mental health crisis among students who were extraordinary, or sometimes first-year students going to university, at the university for 2 months. And then suddenly all those dreams just wiped and saying, you have to go back home. It was an extraordinary time to be doing research around student well-being and the lack of support. And at the same time, engaging with hundreds of students' experiences as they moved across different parts of the country. Yeah.
Tanja, do you want to come in, or you write?
Just perhaps very briefly in relation to the methods question. Very briefly.
Very.
Just wanted to say that I was working with digital technologies before the pandemic, and it really made me think about how different types of technologies shape our field site. So how they reshape it in the terms of what kinds of data we are able to gather, and what kind of, how we form relationships with our interlocutors, and then also how they change the norms of field work, actually. So I tried to rethink that through the concept of the field event. And in terms of the privilege, I think that, of course, me and my co-author were both privileged ethnographers, in the sense that we conducted our research from our very safe homes. And the social media that we researched assumed that, you know, everyone pretty much who uses social media has a safe home. But we've seen from the comments made on domestic violence that this clearly isn't the case. So there's another divide that exists. Thank you.
Thank you.